Hello everybody, my name is Dr. Lisa Chong. I'm your TMJ and tongue tie specialist. Today I will be talking about TMJ dysfunction. A lot of my patients come to me and say, Doc, I have TMJ. Well, TMJ really is an anatomy of a joint here. It is bilateral, which means there's both sides to it, left and right side to it, and is held by a jaw bone called the mandible. So that's TMJ. TMJ dysfunction is when you have pain problems related to this TMJ complex. So it is held by ligaments, and the anatomy which I'll show you, there is a ligament, there is a disc that's attached to it, and sometimes the disc click and pop and comes out of position, and that's why you hear the sound clicking and popping, because the disc actually pops out of position. And sometimes when it's severe enough, it actually locks up, which means that this is placed forward and locks, which means that when you actually have an open lock, your jaw locks open and you can't move your jaw. When you have a closed lock, means that your jaw is closed and you can't open your mouth. So that's a closed lock. So this is quite a debilitating disease because patients who suffer from this are affected psychologically as well, not just a physical pain. A lot of some of my patients are also taking medications such as SSRIs, and the SSRIs can also make a person grind their teeth even more, which exacerbates the whole cycle of teeth grinding situation. So what are TMJ dysfunction symptoms? The symptoms are joint clicking, joint popping, hearing problems, vertigo, where you feel off balance. There are symptoms of headaches, migraines, neck pain, shoulder pain. There's also issues with teeth grinding. There's issues with jaw locking. There's issues with jaw clenching issues. And sometimes some of these problems are related to airway obstructions, which is quite a common cause of problem. And sometimes some of these causes are caused by orthodontic relapse, where the teeth have moved and the jaw is misaligned. So some of these issues needs to be assessed carefully by your TMJ specialist. And hence, it is not just so simple. And sometimes there are multifactorial problems such as airway, tongue tie, symptoms of teeth problems, missing teeth, open bite, crowding, premature contact of a tooth that causes deviation of the jaw. There's problems with, let's say, an upper arch which has missing teeth, and the lower arch has another missing teeth which are not positioning properly. There's a midline problem where the top and bottom of your jaw does not line up properly. There's problems also that can be referred from the head and neck region, such as this problem. A person has a forward head posture, and that forward head posture could be related to posture, could be related to a tongue position where the tongue is postured on a low position and the patient's breathing through the mouth, or sometimes the patient cannot breathe through the nose because of allergies, hay fever, or even obstruction from anatomical obstruction. So all of this come into play that contributes to TMJ dysfunction. So today we've learned about what are the causes of TMJ dysfunction. I would say these are the whole list of TMJ dysfunction. And the next time I see you, we'll talk about each one of these topics. Thank you very much for listening to me today, and I look forward to seeing you at my next video. Bye-bye.